breaking news.
We interrupt programming for breaking news. Milwaukee City and county leaders are providing another update on the coronavirus pandemic. Let's listen in.
And covering your nose and mouth when you cough or sneeze. These are simple but painless actions that we can make a habit of. And personal decisions individuals are making about attending parties, group events, social gatherings, etc., are directly impacting COVID-19 disease rates here in Milwaukee County. COVID-19 is not fun, and no one is invincible from catching it. We started hearing from numerous professional athletes, and we've seen a few Bucks players, men and women, who are young and healthy, speak about their experience about fighting the novel coronavirus, and it's not pleasant. So please don't be fooled into thinking that just because you're young and healthy, the virus won't affect you. Don't be afraid to ask your friends and family to wear a mask if you're getting together with them, and you have to take ownership of your own health and the health of your family. And if you're gathering with people outside your household, please get tested. There's still so much we don't know about this virus, and we all have to help mitigate the spread and protect our community. So please make sure to visit or call Impact 211 to look up testing sites near you. Also, based on the data available to us, it shows that wearing a mask is an effective way to help mitigate the spread of COVID-19. The county made a few updates to our mandatory masking policy. Effective as of 12:01 a.m. on Saturday, August 1st, any person 3 years old or older will be required to wear a mask upon entry into any indoor Milwaukee County facility or indoor service area, which now includes Milwaukee County buses and at the Mitchell International Airport. Bus operators will enforce the policy at the same time and in the same manner as fare collections. Riders will be asked to wear a mask upon entry to the bus, and if they refuse or remove their mask during the ride, they may be encouraged to put a mask on for their own protection and that of other passengers and drivers. Milwaukee County Transit System shall provide a limited number of disposable single-use masks to riders who do not have their own face masks. And face masks will be available at the customer service desk at the airport while federal supplies last. And any person 3 years old or older at an outdoor county facility or on county grounds shall be required to wear a face mask whenever the person is or likely to be within 6 feet of any other person who is not a member of that person's household. Milwaukee County will be supplying masks at the zoo to people who do not bring their own masks, but will typically not supply masks at outdoor park spaces like beer gardens, parks, marinas, or the beaches. And so if you are looking for a mask, there are several great organizations partnering together to make them available. Visit Milwaukee, and the MMAC just announced yesterday that they're dropping off 50,000 masks at Citgo gas stations in Milwaukee, and residents could pick up masks on a first come, first served basis while supplies last. I keep saying masks. The Mask Up MKE is another great collaborative organization working with many community partners and businesses focused on providing businesses, groups, and organizations with masks to keep their employees safe. There is an easy mask request form online and for people to fill out. And the Milwaukee Health Department has been working hard to ensure masks are available at accessible locations throughout our community. These are just a few initiatives giving away free masks, but there are plenty of others who have stepped in to help. But if you want more details, feel free to literally Google Milwaukee masks so you can find where you can pick them up. So with that said, I will hand it off to Mayor Barrett. Thank you for joining us again.
Mayor Barrett, are you with us? I see he's on the call. Perhaps as we wait for Mayor Barrett, Dr. Weston, would you be ready to go?
I'm all set here. Sorry about that.
All right. Oh, there you are.
I apologize. But a couple of things that I want to talk about a few different topics, if I might here. First, I want to talk about the election that's coming up. As some of you may know, we've got an election coming up on August 11th, and we are now in the process of having early voting. Believe it or not, early voting begins today. In-person early voting begins and runs through Sunday, August 9th. The sites will be open from Monday through Friday from 9 a.m. to 5 p.m. and Saturday through Sunday from 10 a.m. to 3 p.m. There are express locations that are available at the Zeidler Municipal Building, the Manitoba School on the south side, and Midtown Center on approximately 60th and Capitol. In addition to that, limited sites are located at various Milwaukee Public Library branches and schools, allowing for voting for one person at a time due to the spacing concerns. If people are looking for a full list of early voting site locations, visit milwaukee.gov/election. Obviously, we all remember what happened in April and the challenges we faced. The Election Commission has been working very, very hard to make sure that this is, in essence, a marriage between our Election Commission and our health department. And that means they're taking some very specific safety measures. We will have mask ordinance enforcement. There will be plexiglass barriers in place for early voting, the use of pencil erasers to avoid direct contact on the express voting machines. There'll be an opportunity to, not only an opportunity, there will be a sanitizing of all pens and pencils, frequent disinfection of all surfaces. Face shields will be worn by early voting staff, especially if not protected by plexiglass, and will have the social distancing rules in effect. I mentioned the masks. I think people are now well aware that the Milwaukee Cares mask ordinance is in effect. What we're seeing nationally is more and more states, more and more locations, local locations are enacting these mask policies because they have been so effective. But our MKE Cares mask ordinance went into effect at 12:01 a.m. on July 16th. That means masks or cloth face coverings are now required by all persons over the age of 3 in the city of Milwaukee, including residents, patrons, and visitors. These apply indoors and outdoors if you cannot maintain the 6-foot social distancing. Businesses are allowed to require this as a policy to provide service. And the city recommends that business owners provide single-use masks, mouth coverings for staff and patrons. I'm pleased to say that the Milwaukee Health Department is providing masks free to the community at 3 locations. There's a limit of 3 masks allowed per person. You can pick them up at our Keenan Health Center, which is at 3200 North 36th Street, Monday through Friday, 11 a.m. to 3 p.m. You can pick them up at the Northwest Health Center, which is 7630 West Mill Road, again, Monday through Friday, 8 a.m. to 1 p.m. And you can pick them up at the Southside Health Center, which is 1639 South 23rd Street, Monday through Friday, 8 a.m. to 1 p.m. as well. We're also working on a community mask distribution plan, which will be developed by this Friday, July 31st. It will provide for more access points for free masks across the city. Our request is pretty straightforward. Please remain vigilant about wearing your mask to help us slow the spread of the virus in our community. As of July 27th at 2 p.m., Milwaukee has seen a total of 14,048 COVID cases and 257 deaths, although I think the number for the county is a little above that. Quick update on the National Guard. On Monday, we saw 1442 on the Southside location, the UMOS location. Custer saw just under 600 for a total of 2,038. Last week's total was over 11,000. And we're very, very pleased that people are continuing to get tested. I'll also point out, because I know there were some concerns about waits, the National Guard testing sites recently began implementing the dynamics testing and registration application. What this means is that the National Guard will be using an online QR code for each person getting tested. I'm pleased to report that testing efficiency has increased significantly, and that means greatly reduced waiting times. The code also moves the contact tracing process forward, improving reporting errors and test results turnaround times, and reduce call volumes to our COVID hotline. So the natural question is, how does this process work? Before you are tested, you will be asked to pre-register by filling out 2 forms, a personal information form, as well as a test requisition form. The pre-registration information can be found by scanning the provided QR code with your mobile phone, or more simply, by using the following link, register.covidconnect.wi.gov. Each person must register individually with a Wisconsin address. Addresses outside of Wisconsin may have delays. Once you've completed that registration, those registration questions, you'll receive an email confirmation with the QR code. So again, if you're having trouble registering on your phone or don't have a phone, the staff will be there to help you. It will just take a little bit more time. In addition, people should know that we have Spanish interpreters will be available on site at both testing locations, and there will be a language line available for other translation needs. You will receive your test results between 3 and 7 business days. We're trying to obviously shorten that, but that's where it is right now. If you test negative, you will be emailed a secure link to view and print your results. And if you test positive, you will be called by local public health staff. The last issue that I just want to touch on is the DNC preparedness. Our role, the city's role, as many of you may know, the convention begins in a pretty much a virtual fashion 3 weeks from today, but it will be here in Milwaukee. And the health protocols in place for the Democratic National Convention appear to be thoughtful and thorough. From day one, they have made public health as the #1 criteria. So there have been no political games. You've seen a lot of drama on the Republican side. We haven't experienced any of that, knock on wood, at this point here in Milwaukee. And I'm very, very pleased that the convention organizers have been working closely with our Milwaukee Health Department. And while it's important to protect every person attending the convention, not surprisingly, my priority is to make sure we protect the entire Milwaukee community. And these protocols establish reasonable requirements in order to prevent additional COVID infections, both at the convention and here in Milwaukee. So a lot going on. And with that, I think now I'll turn it over to Dr. Weston. Thank you very much.
All right. Thank you, Mr. Mayor. Good afternoon. First to our numbers, we've had 18,485 cases of COVID-19 in our community and 381 individuals who have died of the illness. We continue to see elevated hospitalization numbers related to COVID-19, and we're closely monitoring the apparent gradual increase in deaths as well. As we currently are fully engaged in efforts to fight the COVID-19 pandemic, we also know that with the fall season looming, we'll have the additional challenge of influenza. Each year, tens of millions of people become sick with influenza, hundreds of thousands are hospitalized, and tens of thousands of people die from the flu. While influenza is not as contagious nor as deadly as COVID-19, the flu has a major effect, to be sure, on our health systems and on our society's productivity. It's easy to imagine that the combination of a particularly bad flu season paired with an increasingly severe burden of disease from COVID-19 could lead to a historically challenging, despairing, and deadly fall and winter. While physical distancing and hygienic practices can prevent both illnesses, one advantage we have in fighting influenza is an effective vaccine. In past years, despite preventing millions of illnesses and thousands of deaths, only 38% of Milwaukee County residents received the flu vaccine. That's lower than the statewide average, and that rate is even lower when you look at minority and low-income populations. Those often hit hardest by COVID-19 as well as influenza. So with COVID-19 continuing to see increased number of cases, percent positivity, and hospitalizations, and those numbers expected to increase in the fall months, this season will be more important than ever for everyone to get a flu vaccine. It's with this in mind that the Milwaukee Healthcare Partnership has recently formed a multi-sector 2020 flu vaccination work group. They have representation from Milwaukee County, local and public health departments, health systems, federally qualified health centers, pharmacies, and state partners as well. The aim of that group is to increase flu vaccination rates in Milwaukee County, especially among vulnerable populations, and really decrease the amount of flu-related hospital utilizations. So we at Milwaukee County, and I think the municipalities as well, are pleased and excited to be working with the Milwaukee Healthcare Partnership as they spearhead this important effort in our community. We'll continue to talk more about this critical mission in the coming weeks and months. Remember, September and October are the best times to get vaccinated. And so we'll provide more information as those months approach and throughout the flu season. Thank you very much and stay safe. And I will hand it off to Commissioner Kowalik.
All right, thank you, Dr. Weston. So as noted from our mayor and county executive, the importance of taking additional precautions to prevent the spread of COVID-19, regardless of your age or perception of risk. We know what we need to do to prevent the spread. And as I'm wearing my mask right now, I'm outside of my house. Granted, no one else is in my office, but just masking up whenever you're out of the house. We continue to receive a number of questions about Milwaukee Cares, our mask ordinance. about different scenarios, but at the end of the day, the rule of thumb is whenever you're leaving your house and you're not with people that live in your house, you should be wearing a mask. We know that there's individuals in our community that have various health conditions, whether they be mental or physical, that cannot wear a mask. And that's a very small amount of our population. But for everyone else, the mask is going to protect not only others from you, but you from others. So we want to just continue to promote that messaging. Access to masks will continue to increase. The health department is in the process of finalizing this community distribution plan for masks, where we will provide a variety of masks. And I put some on my social media earlier, but just to show you again, just the health department masks are free, and that's why they have our logos on them. This is breast cancer awareness. This is Pride. And then we have our Pan-African, African American, or Black Pride colors. And then we have our vision, Living Your Best Life, Milwaukee. And there's others. So the others have like this, the plain health department logo with the blues and the greens and different patterns and things like that. So we wanted to be sure that we were promoting mask wearing and making it fun and stylish. As you know, I like to be stylish. So doing it in a way that will help encourage some use, because again, we know it's summertime and we know that it's not necessarily ideal to wear a mask for many people, but wearing a mask is a way to provide some protection. And also the distancing is very important, the 6 feet from others, being outdoors and limiting any indoor congregations, very important. We continue to see some of these outbreaks for these parties that people are throwing, thinking that it's not a big deal. I know these people. Well, the virus doesn't care if you know them or not. It can still be pretty contagious in those types of settings. So just reminding our young people that want to live it up, living your best life, again, to do so in a way that's very mindful, because we, again, don't want to continue to see what we're seeing in many places across this country, where we're seeing a rise of cases among young adults and adolescents. So just putting that out there. Speaking of young people, the health department is still having conversations with schools, whether they be K through 12, as well as colleges, universities, and trade schools. So there's a number of plans that we're reviewing and meeting to discuss some plans, adjustments that may need to be made to make sure that the risk of COVID-19 is minimal. So that's in process. Also, I talked about the masks and the compliance for masks. And again, you should not be paying for free masks, the health department branded masks. There was also through Visit Milwaukee, there was an initiative to get masks out yesterday. So we're very grateful for that collaboration because we know that not everyone can afford a mask. So we want to make sure that there's broad access in our community. We also want to highlight testing, and getting tested whenever you think you may be exposed is very important. So I just want to talk about two things related to that. So in accordance with state and local guidance, it's important that anyone that has symptoms of COVID, whether it be one symptom or multiple symptoms, get tested. So that can be fever, cough, shortness of breath, loss of smell, taste, upset stomach, diarrhea, sore throat, and head issues, head pain, things like that. But we also know that there's people that are asymptomatic, just like some of our athletes that have been in the news that have had symptoms or very minimal symptoms, that you should still get tested. So those community testing sites, the UMOS and the Barack Obama High School, which are located in the city of Milwaukee, provide testing for asymptomatic and symptomatic individuals. I know many of the providers in our area are providing testing, whether it be drugstores or clinics or hospitals. And we know that a lot of those tests there's wait lists or appointments are full and things like that. So we want to just continue to encourage the public to continue to take advantage of the community testing. The Barack Obama site has lower numbers than the UMOS site. So if you have transportation and can get to the north side, definitely check that site out to get your COVID tests. again, if you think you may have been exposed to COVID, first of all, you shouldn't get tested right away because it's not going to give you the results that you may be seeking. Say if you found out you were exposed to someone that's COVID positive yesterday, you should probably get tested on Friday, because then that'll give your body enough time to show that there might be some immunity or something trying to fight the virus. So definitely wait a couple of days. Like I said, if it was yesterday, I probably would do it on Thursday, late Thursday or Friday. If you're unable to get tested, you should be on quarantine for 14 days from the point of contact to see if you if you develop symptoms of COVID or not, because we know that there's people that are asymptomatic. But by limiting your interactions with other people, that's a way to prevent the spread of the virus. The health department is still aggressively completing contact tracing activities. And we know that some people have had some aversion to this, where you don't necessarily want people calling you every day or reaching out to you every day. But according to our contracts with the state and just good public health practice, it's important for us to find out how you're doing, to see if things are stable or if you're getting worse, because we want to make sure you're getting guidance if you need to go to the hospital or anything like that. We want to make sure you're educated about your course of disease and what you need to do to try to minimize the impact of COVID-19 naturally, because there's no cure. So there's some things that you can do to boost your immune system, such as taking additional vitamins, vitamin C, zinc, and some other supplements that you can take depending on what your healthcare provider might say. I know many people don't have a primary care provider, so they don't have anyone that they can bounce things back on. I would highly recommend using resources like the Mayo Clinic for guidance on natural immune boosting techniques. And then other things that I've mentioned before, and I'm just going to mention it again, is getting adequate rest. Making sure that your body's immune system is able to really ramp up and fight the virus by getting good sleep, and most importantly, drinking enough water. We know it's summertime. A lot of folks don't think about drinking water unless it's in your face or a last resort. So staying hydrated is extremely important to help your immune system fight off anything that you may have in your system. So again, water, not being dehydrated, getting adequate sleep, and then of course your diet or any supplements that you're taking to really help. Caffeine and alcohol aren't going to help your immune system. Tobacco smoking will not help your immune system. And then eating a lot of sugar, so increasing the acid in your system, is going to make it harder for you to fight any virus that your system may have. You need to be more alkaline, so definitely more leafy greens and things of that nature. So I just wanted to touch on some natural immunity concepts that sometimes we don't talk about. We just talk about testing and wearing masks. But if you happen to be exposed to COVID or just general practice, because you know it's in our community, these are some things that you can do to help yourself. And then lastly, I know we got some questions about the DNC, and the mayor touched on those, but just the health department will continue to be actively engaged in conversations for planning and rolling out the DNC. One of the items that came up yesterday was about the daily testing that will happen. And of course, those are always issues that we tend to receive about, okay, if there's all of this daily testing, how does that take away from the community? When you have groups coming in doing their own thing, they tend to have their own or make their own arrangements for additional testing resources. So I just wanted to be clear about that. It wouldn't be taking away from what we have available here, just like Major League Baseball with their testing protocol, and the NBA or any other larger group that has the resources to do more regular testing for our cohort of individuals. So that's pretty much all I have for today. So thanks for your time.